remember very specifically when I was very young that my grandfather had a heart problem. And I remember trying to understand, and I was only about 10 years old or 11 years old at the time. Why was it that he got so sick? Why was it that he had to sit down every block or two? Why was it that he was short of breath? And so I tried to understand that. I tried to teach it to myself. So I tried to read what I could understand at the time. And I had an appreciation, I think, through my family of the relationship that my family had with the doctor, the healer. And this person was a real humanist, and he came to the house at times, and he spoke to the family, and I saw how he spoke to my grandparents, who really didn't speak that much English and may not have understood that much, but I saw him at the bedside, and that was my first experience watching medicine be practiced.
The possibility of the non-cognitive therapy allows to work with someone that doesn't speak your language, that cannot even describe what the problems that it has. Allows you to work with people in coma, allows you to work with people that have difficulties to connect, whatever they have, different syndromes or handicaps. The connection with the soul doesn't need, any of those barriers.
My father comes from a small town in Lithuania, and the woman who was my pediatrician when I was growing up was a woman who escaped, Nazi Poland at the same time that my father did. And she was the same kind of healer. She was talking to the family, talking to, she was sort of treating us as whole beings. And I remember her making house calls, and I remember when my sister had meningitis that she came to the house and scooped her up. So those were my memories of healers. They were humanists. They were real people who cared about people.
I really believe in the power of intention. And when I approach a healing, because I'm also a traveler, I try that to be an important event. Sometimes I know that we will not have another shot. And I know that the patient is putting in your hands at least 3 very important things. It's time, which is valuable, it's resources, and I work at least 1/3 of the people that I do are very poor, and I go in Peru to the mountains, and then they put the hope, which is it's also a value, it's a spiritual value, and has to be considered as a capital too. So they put all of those things in your hands, and then you are not infallible, you cannot promise anything. The only thing you can promise is like you are going to approach it the best that you can. So this kind of jumping out of the cliff and not having any reserve of fear, and not thinking about what they are going to think about your healing or your capacities, you just go for it. That attitude produces a very strong flow of what I call the force of life. And sometimes we have these very amazing results in 1 or 2 sessions.
Mm-hmm. Let me ask you this. How do you think that your application to the patient actually heals them? Is it by knowledge? Is it by chemistry? I mean, how do you think that you're not handing them a medicine, you're not handing them a pill?
No.
So how do you think your application to the patient actually makes them heal?
Yeah. Well, it's interesting because another way of asking the same question I have heard frequently when I'm doing talks, when people ask me, how much is you who is healing, and how much is a bigger force or a natural force that is coming? And the most honest question that I can say is both. Because I feel when I'm touching someone, I'm getting all these patterns and colors and things. And then on another hand, sometimes I feel that something unexpected appears on the table that is sent by the patient. And if I don't deal with that and I just skip it, or I just pray for that to be healed and I don't take a really strong action, something will not work. So sometimes when something is pop out so clearly, I have to go for it and I have to use my tools.
One of the things that I remember from my training at New York Presbyterian Hospital was a very senior psychiatrist speaking to a patient that I thought I knew from having taken care of her, but just seeing what he could get her to reveal about herself with a few simple questions. And it made me realize that, firstly, people don't necessarily present to you all of the details, and that you really have to pay attention to the cues. And sometimes when you get that information, they seem to get better in some almost magical way, which, you know, I believe that brain chemistry and the whole endocrine hormone system definitely affects how we heal. And if you're very stressed and you're in pain and you're stressed for any reason, you don't heal. And if someone even has a minor condition and they're enormously stressed, if you can alleviate that stress, either their perception of the condition or the condition itself will improve by virtue of that. So that's why I feel like we as Western trained physicians need to be open to other modalities, because we don't know about all those secret chemicals floating around.
I believe that the fact of knowing that we are all the time ignorant about one section of life and the way the universe works allows us to access to that part. Mm-hmm. The I know it all, or the excess of confidence that the scientific method has all the answers is what is trapping many times the possibilities of a healing.
Mm-hmm. I totally agree. I mean, I think that we have to be open to alternative methods of healing, and we have to be understanding that we really don't know all of the modalities that people can bring to bear in healing themselves.
I feel also that from the vital energy part of my work, I'm kind of enhancing the self-healing process of the patient. And no doubt that the glands, that the endocrine system is, of all the tissues of the body, the one that is on the hinge between the energy and the body. I can feel it. Sometimes I work with someone and they start to salivate very strongly. So what is expressed and clearly felt on the mouth as saliva, it's also happening in all the rest of the glands when they start to be pouring, you know, their substances and getting balanced.
You know, one of the most powerful and very well-studied examples that I always allude to is that the studies of infertility, you know, we have all of these incredibly complicated scientific methods of inducing eggs to be produced and embryos to be made and pregnancy to happen. There are many studies now that document that women who are undergoing fertility treatments, which are very physically and emotionally challenging, do better if they do meditation. They have a higher pregnancy rate. They do better if they have acupuncture. And so we know that there has to be some humoral component to those techniques. It's not only that they laid down on someone's table and they pressed on certain parts of their body. Right. It had to correlate to something chemical or humoral in the body, and therefore, you know, we have to be cognizant of the fact that that is a healing modality that we've not tapped into, and we don't know entirely how to tap into it.
I think that personally I have enjoyed very much the cases where a couple couldn't have a child, or cases of infertility. Many times it has been for different reasons, totally different reasons. But the fact of the wish of a couple or of a woman to have a child and the frustration of being told that everything in the body seems to be okay and then it's not happening. And to find somehow a way of make that happening because something was maybe imprinted on a more kind of soulful or unconscious level, and to just relax and solve that and produce the coming of a child, something that has given me a lot of satisfaction.